Alberta optometrists are trained to do much more than our current scope of practice allows. The Alberta College of Optometrists is recommending government expand our scope for faster delivery of safe and professional eye care to more Albertans across the province.
Optometrists are primary eye care providers. You can think of us as the family doctor of the eyes. There are over 800 optometrists available in Alberta. We provide a lot of services such as comprehensive eye exams, all the way to acute emergency eye exams. We diagnose and manage a wide variety of eye diseases such as dry eyes, glaucoma, cataracts, macular degeneration, and superficial eye injuries.
There are 3 main laser procedures they could perform if scope expansion is approved. The first procedure is a capsulotomy.
The capsulotomy laser is used to treat secondary cataracts in patients who have undergone cataract surgery or refractive lens exchange. Sometimes there can be a little bit of a membrane that forms right behind the artificial lens that was implanted. From a patient's perspective, it can seem like there's another cataract coming on. The vision can be blurry, you can experience light sensitivity, and you can also see an increase in glare symptoms. This really reduces the quality of life and the patient's vision, and it can affect all things, including driving, watching TV, reading. This laser cleans that area up. It's a simple procedure. It can be performed in a matter of minutes, and results are almost immediate.
The second laser procedure that optometrists in Alberta want to be able to perform is a peripheral iridotomy.
Everybody has a drainage structure in their eye. It can be very open or it can be very closed. So in patients whose angles are a little bit more narrow, we run the risk of the eye pressure rising if the fluid is unable to drain from the eye. This laser procedure makes a small hole into the iris. It provides an alternate route for the fluid to drain out so that the pressure doesn't rise.
The third laser procedure Alberta optometrists want to add to their scope of practice is selective laser trabeculoplasty.
The SLT stands for selective laser trabeculoplasty, just a fancy term for a laser that helps treat primary open-angle glaucoma. It is a condition that can damage the optic nerve and result in peripheral vision loss. It provides an alternate option from your typical glaucoma eye drop therapy. So we apply this laser to this area, and it also helps drain the fluid. The typical treatment for primary open-angle glaucoma is usually eye drops. Eye drop therapy is a good therapy for a lot of patients, but sometimes it's not enough. So this is a great alternative to replace those eye drops so that the patient doesn't have to worry about putting an eye drop in every day to lower their eye pressure.
In addition to the 3 laser procedures, the college is requesting authorization for Doctors of Optometry to perform limited laser and superficial skin procedures on and near the eye.
Lumps and bumps can be anything from a simple skin tag that you see on an eyelid or the eyelid area. Sometimes dyes are really stubborn. They can last several months and they don't resolve with our typical conventional treatment. We do have this Elman unit that uses radio frequency to gently remove the lesion or the little lump or skin tag in a safe manner.
Alberta College of Optometrist members are educated and clinically trained to provide skilled and competent care. They are committed to public safety, the preservation of sight, and mitigation of vision loss for all Albertans.
Optometrists actually learn and study these procedures as part of their 4-year doctorate program. Allowing optometrists to perform these minor surgical procedures will greatly reduce the wait times. Even if you refer a patient to a glaucoma specialist for just an LPI or an SLT, it takes about 6 to 12 months. Something as simple as removing a little lump from the eye is taking up to a year. If an optometrist is able to perform these procedures, patients can get in within weeks. Optometrists can then work in collaboration with ophthalmologists so that they can focus on the more specialty eye care. All of these procedures are really safe, they're effective, and there has been no reported case of harm. Being able to provide them would be able to get patients in quicker, results would be faster.
For more information, visit the Alberta College of Optometrists website.